Hi everyone, welcome to day 1 of week 9. So this week our main focus will be on medical emergencies and assisting in those situations. So that means we're going to be dealing with chapter 43. This week is also going to be a very special week for us, as we will have a guest speaker that's going to be coming in on both day 1 and day 2 from Heart Solutions. And this individual will be teaching you about CPR, AED, and first aid. So by the end of this week, you guys will be certified in those areas. So please make sure that you try to come to class not only on time, but both days are going to be very important for you to be there. So like I said earlier in the video, we're going to be dealing with chapter 43. And that chapter is all about medical emergencies and your responsibility during those situations. As a medical assistant, you need some extra training in those areas to make sure that you are thoroughly prepared. Now that may be on-site training, but it's also part of being in this field and in this program. We kind of help get you to where you would be able to assess those situations and address them correctly. Anytime there is a medical type of emergency, you always want to contact the physician, and they have to be notified immediately. But you also may need to contact someone other than the physician, depending on the severity of the situation. You may need to call some emergency services, such as your EMTs, or those emergency medical technicians, advanced medical technicians, paramedics, or medical responders. So when we start talking about medical emergencies, we also need to discuss the Good Samaritan laws that come into play here. Now back in week 2, I want to say, we did talk about Good Samaritan a little bit, but we're going to go a little more in depth on this topic as this is now going to be dealing with medical emergencies. So Good Samaritan laws were established to encourage healthcare providers to volunteer in emergencies without the fear of financial liability. So for example, let's say that you're doing CPR for someone and you crack their rib. Now, it's very common, it happens quite often, but you as a medical practitioner are not liable for that expense that happens afterward. Good Samaritan laws will apply both to situations that happen in the medical office and those that happen outside of the medical office. And as a medical assistant, you really have 3 primary legal responsibilities in emergencies. The first responsibility you have is the duty to act within your scope of practice. Remember, you are accountable for not only yourself, but your employer and the public health as a whole. So don't do something that is not within your scope of practice. Your second responsibility is to ensure and document the consistent emergency readiness of your office in which you work. Making sure that you're going to those yearly trainings and you're doing the updates, making sure that you are ready for all of the changes that could potentially happen to an emergency plan. And the third responsibility is to do all you can to prevent those emergencies from happening. So in doing that, you need to make sure that you have your preparedness plans in place so you can help to avoid those emergencies and some of those things that could happen. There are some guidelines for providing emergency care, and as a medical assistant, you really must stay up to date on emergency plans of the office or the facility you work for and the community in which you work in. You also need to be able to handle emergencies that come in 3 main types. They could be on the phone, in your office, or near your medical office. So the most common one that you will see and deal with is going to be emergencies that come on the phone. And this is where having good triage skills will help. So what triage means is you're going to have to be able to assess and prioritize the emergency and the care that the patient will need. So you have to be able to say, this is the most important, then this, and this, and this, and kind of branch out from there. Now, every doctor's office will have an emergency crash cart or crash kit available in situations. This crash cart will contain supplies that may be needed during any sort of an emergency, and it should be instantly available for anyone who works within that medical facility. All patients should be able to have this available to them if an emergency does happen, but you as the medical assistant, the nurses, the doctors, the front staff, all of them should have access to this as well. With the crash cart, or close to it, will be what we call a medical or drug box. This will hold drugs or medicines that may be needed during certain emergencies. Some medicines that you might see in this kit would be activated charcoal, Benadryl, epinephrine, insulin, lidocaine, nitroglycerin, and normal saline. Now, you may also see other types of medicines, but these are the most common ones that you will see in there. So now let's get into some of the fun here and discuss some of the medical emergencies you might encounter within the facility. Now, because Heart Solutions is going to be coming into our class on day 1 and day 2, I want to make sure that I don't really touch a lot on CPR. Reason being, your whole class period is going to be designated to CPR one day and first aid and AED the second day. So I'm going to really let Heart Solutions take that one and have you as prepared as you possibly can be for them. But a situation you might come into contact with is respiratory distress. Now, respiratory distress can happen due to a reaction for a long-term disease, such as COPD or asthma, but it could also be due to an allergic reaction to a medication. If that is the case, that's called anaphylaxis. Okay? So as a medical assistant, you need to be able to recognize some of the signs and symptoms that go along with respiratory distress, so you can act quickly if you do see those sort of things starting to happen. Some of the signs and symptoms you might see are some acute anxiety with gasping breath. You could see bradypnea, which is that slow, shallow breathing, and you generally are going to see less than 8 breaths per minute. You could see cyanosis, which is the patient starting to turn blue. It generally will start on the fingertips and the lips. You could see a failure of the chest to rise and fall, nasal flaring, or noisy breathing. Now, you could also see the opposite side where the patient has tachypnea, which is pretty much them rapidly breathing, taking really short, quick breaths to try to get air in, and they'll have probably over 24 breaths per minute. As a medical assistant, if you're seeing any sort of respiratory distress, the first thing that you should do is really try to hook the patient up to oxygen and get that administered to them as quickly as possible to help them breathing. Another situation you might come in contact with is a patient with chest pain. Now, heart attacks are the leading cause for both men and women in the United States. So it's really important as a medical assistant, you can recognize those signs and symptoms and act quickly. So some of the things you might look for are pain in the middle or left side of the chest, and that pain is going to be described as a sharp, stabbing, crushing, squeezing, or aching pain, and that pain can radiate to the left arm, to the back, or up the neck. If that happens, first thing that you should do is try to get the patient a nitroglycerin from the medicine box or an aspirin. Try and get something to stop that effect as quickly as possible and calling 911. So, if your patient, let's say, calls into the office and says that they are having chest pain or potentially having a heart attack, there's some rules that you need to follow to make sure that you get that patient the best care possible. First and foremost, never hang up on them. Always keep the patient on the line and have another coworker contact the 911 services or EMS, direct them to the patient's house, and you stay on the phone with the patient until EMS does arrive and take over care. Reason being, if something happens to that patient, and let's say maybe they pass out during your phone conversation, you still want to stay on the line so that way when EMS does arrive, you can give them the details of your conversation. Never hang up on a patient and never leave them alone. Don't hang up, tell them to hang up and call EMS themselves, because you don't know what could happen in that 30 seconds that it takes for that to happen. And the last situation I'm going to talk about for today's video that you might encounter is someone in shock. Now, shock is a collapse of the cardiovascular system, and it's caused by an insufficient cardiac output. So it means the heart isn't acting as it properly should. In this type of situation, you want to look for signs and symptoms of weakness, rapid heart rate, thirst, cool or clammy skin, confusion, unresponsiveness, or nausea. If you see any of those signs and symptoms, the first thing that you want to do is have somebody call 911 right away. And then you're going to want to help the patient. I generally try to say get a blanket or something for them to keep them warm, and just move everything out of the way so if they do go into maybe some sort of seizure aspect, they will not hurt themselves. Alright guys, so that's where I'm going to stop for the video for today. Please make sure that you do arrive on time for both day 1 and day 2. It's really important that you guys are there for both days so you can get the certification for both CPR and first aid. I look forward to seeing everyone. Have a wonderful weekend, and I will see you on day 1 of week 9.